For survivors with uteruses, sharing pregnancy information and pregnancy outcomes can pose risks. Risk from a harm doer and systems risk. Pregnancy increases risks of lethality, and what we know is that pregnancy information may not be protected and can be shared without a survivor's knowledge or consent. And this shows up in different ways in civil legal cases where it can be used to discredit or attack a survivor, and in criminalization of pregnancy outcomes. And this culminates in weaponization of health information and really severe and harmful impacts for survivors. And healthcare providers play a critical role in intervention. They can help to integrate practices into their everyday routine that create safer spaces for survivors really easily by reflecting and interrogating practices, recognizing and trusting survivors, and providing full spectrum care. Reflecting and interrogating the purposes of questions and their impact on healthcare options is critical. When we're asking, when was your last period, or what was the outcome of that pregnancy, we really want to challenge ourselves to be curious about the expectations and entitlement to this information. Recognize and trust that sharing or not sharing information can be rooted in self-protection for survivors. Self-protection from a harm doer and from a health system that can't guarantee that all their health information is safe and protected. So really want to encourage people to be mindful and to take efforts not to collude in any harm doing. Finally, I want to encourage full spectrum of care that is not dependent upon pregnancy status. Really taking time to provide education and risk analysis that's related to the treatment and also to the harm doer risk. Taking that approach centers informed decision making, it increases patient agency, and it really does model patient-centered care. Integrating these small pieces into practice really supports trauma-informed, patient-centered care for survivors. And it's important to remember that the person sitting in front of you is the patient. So I'm asking, how do you, in your role, in your daily life, do something different to create a safer, more protected healthcare experience?